Well, listen, we're going to talk sports medicine right now. Our good friend who's been with us over 25 years on the morning show, great friend of mine, Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, in for his Wednesday appointment with us. Dr. Joe, what do you have for us today?
Hey, Ray, who's got an appointment with who here? I think I need an appointment with you. I'm hearing so much Tua stuff. I need a little bit of input from you. I know that that's all the talk in town, and rarely do we have one topic that's so dominant as the talk about Tua's injury. We have football people, sports people, medical people, non-medical people. Everybody's talking about what should go on with Tua, and I think, partly seeing it on the TV screen, knowing what he's been through, knowing the big contract that he signed this year and a bright future, and yet still that very difficult clinical problem known as concussion. And it is, and you and I have talked about it so many times in the past, it is the really difficult problem for those of us in the sports medicine world. It's so complex, Ray, and so that's why I almost have to kind of chuckle or recoil a little bit when people talk about it. They sound like you can make a very easy, quick decision on this, but it's very, very complex. And I know they've gone through a lot of testing, as we've gone through a lot of testing with everybody that has a concussion. Yesterday in our office, there were 8 concussions in the main office of the Sports Medicine Center at Children's, and I know we had a lot of other concussions in Medina and at the University of Akron and Mahoning Valley. This is the concussion time of year. There's a lot of concussions out there. And the problem is, as I've talked to you about before, concussions just are not like other injuries where they follow a pattern. They're not very predictable at all. So it's very hard to tell parents and athletes and coaches when these might improve, when somebody might be safe to play. All of those things are very, very difficult. And so one of the things that is an advantage in our world is that pediatric concussions have a lot higher chance of improving more quickly. In fact, you have heard me, I think, use this statistic before. About 80 to 85% of concussions get better in the first 10 to 14 days. But they're scary in the first couple of days, and they're scary the first night when they happen. And the evaluation that we do for those, I've gotten the opportunity this year because I've turned over some of the leadership at sports medicine to some of my junior partners to be out at other areas covering games, and there just is not as many people out there to help evaluate concussions, so they're very hard to evaluate initially. They take a long time. The tool we use is called the SCAT-6. People throw that term around, too. That means Sports Concussion Assessment Tool. It literally takes 20 or 25 minutes to do a SCAT-6. And the problem is almost everywhere, we only have one certified athletic trainer who's out there looking for injuries. If they do a full SCAT evaluation for 20 or 25 minutes, there's not going to be anybody looking at the field for other injuries that could occur over that period of time. And so sometimes there has to be a modified SCAT to get a sense of where that athlete is or how significant their injury is, and then maybe a full SCAT after the game where they do the full 20 or 25-minute evaluation. The second part is it's so unpredictable as to whether they'll improve or ups and downs with concussion, is that we really like to have them seen again within 48 to 72 hours. And that's a little unrealistic in a lot of medical practices for somebody to see these concussions in that short of a period of time in the same week when they occur. And so that makes it difficult as well. And, of course, another issue that everybody worries about is everybody's aware of once you've had one concussion, there is a risk of the brain to a second concussion. We don't know when, though. It's very hard to know how long it is before these recover and when people are safe to go back. And that's all the issue with Tua. Is he ever going to be safe to go back after having 3 very significant concussions, including his concussions really are what were called seizure-like concussions, where he had posturing on the concussions. And so finally, there's so many types of concussions. There's the cognitive concussions where people have memory loss. There's the ocular, where it's the visual problems that athletes have. There's the balance concussions or vestibular, where the room is spinning around or they're struggling with the balance issues. There's the cervical, the neck, or muscular concussions. And, of course, there's the significant issues with mental health of anxiety and depression, very high rates in the 30% or more of kids that have had several weeks of concussion symptoms. So it's so complex, so very hard to deal with and answer the questions, and so many questions out there, and everybody's asking those questions about Tua, and I'm afraid right now it's a little too soon to be able to answer those questions.
And, Joe, on the home front with our Browns, there's a lot of discussion going on right now with the Browns inside their clubhouse pertaining to Denzel Ward, who's had, I don't want to say the Tua type of concussions, but he's had a number of concussions, including a few weeks back, and there's a lot of discussions about Denzel Ward's future. And, of course, Denzel right from Nordonia, right up the road, and one of the best cornerbacks in the NFL. And, again, another big contract his way, and there's also speculation about his future.
Yeah, I think we talked about him a couple of weeks ago. He is our answer to Tua. I think there probably isn't as much national discussion, and his haven't been as visually obvious to see his concussion. Sometimes we don't even know about him till after the game or the next day that we hear about his, but that's very concerning. But again, you have to really look at the details of this 25-minute examination where there's a lot of questions and a lot of evaluation of different areas to know the extent of the concussion, how quickly is he recovering, how well is he doing after the concussion. We just don't know the answers to those things. But it all does come back to the issue of there seems to be a decreased threshold. In other words, easier period to have another concussion when you've had one. And, of course, we are concerned about the outcome. So here we talk about there's been advances, and we've done a better job with concussion for sure in the last 10 or 15 years. But these are some of the issues that make us most concerned. And this evaluation takes 20 or 25 minutes, and very few people have done a lot of concussion evaluation out there. So it's very hard to find people with the expertise to be able to make these decisions. But these decisions on people like Tua and Ward are very difficult, let alone the 8 kids that were in our office yesterday that are trying to go back out and just finish out their high school career.
All right, Joe. Great information. And by the way, Dr. Joe has spent a lot of the last 25, 30 years going not only coast to coast, but even internationally talking about concussions, sports, athletics, and such. So this is a guy, if you ever want to talk and learn about the concussion subject, Dr. Joe knows it. Joe, thank you, my friend. Good talking with you again about sports medicine. Always enjoy the time.
Thanks, Ray. Enjoy this beautiful weather we're having, man. It's been great.
Oh, so, I agree.
And have a great rest of the week. Thanks, Ray.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital with us at 93.5, 1590 WAK.